I am joined today by Jason Kunick, who is here to help us with some of our pre-conference sessions, specifically taking a look at 3D printing. Jason, you want to introduce yourself a little bit?
Sure. My name's Jason Kunick. I am a certified prosthetist orthotist. I have worked in the field since the late 90s and have held just about every position you can hold in prosthetics and orthotics, from starting as a technician all the way up to clinical specialist and practice managers for multiple offices.
All right, so you've worn quite a few different hats, as have most of us at some point in our various careers.
Yep.
So this particular pre-con, the sessions for MovePA, the focus is on future-ready PT, which kind of makes it sound like all of this is futuristic tech that we're going to get to use at some point in the future, but clearly we're already using some of it in the present. So how much of it is already in use from the 3D printing perspective?
So for us, in our field, as a process orthotist, we work very closely with physical therapists and occupational therapists. A lot of what we are doing now, we've been utilizing digital scanning for years and years and years, and then that in turn led into kind of sort of being able to do the 3D printing. So we have practice now where several of my clinicians are seeing children for cranial remolding helmets. I actually have one right here. I don't know if you could see that,
If
but
you hold it up in front
uh,
of you, it might work better. I think your green screening background
there
is
we
green
go.
screening it out. That is an adorable helmet.
Yes. And the nice thing about I think pretty much all of our patients now exclusively are getting this design, as opposed to traditional ones where we would have to, cast a patient. And, that's stressful for the child, stressful for the parent, stressful for the clinician. But with these, we just do a digital scan, and then they are 3D printed. They have a removable inner liner that can be taken out and washed, whereas the older ones were lined with padding that was not removable. So hygiene levels are increased as far as that goes. And that's just one aspect. We are 3D printing, all levels of ankle foot orthoses. We are 3D printing even some prosthetic sockets that patients are walking around on, from diagnostic sockets to actually their definitive sockets they take and wear every day.
Wow. So it sounds like this is really applicable for a broad range of PTs and not just the pediatric folks whose, patients outgrow their helmets every 3 weeks,
Yes, correct.
which I know is a long-standing issue, especially when it comes to mobility devices for the pediatric population, but
Yep.
definitely applicable for our adult population as well. So
Yeah.
how did you get involved in using this kind of technology? And is this something accessible that other PTs can get into fairly easily as well?
Yeah. So, I mean, I kind of sort of had it thrust upon me. As I said, I've been at this for a while, and technology and advancements just they don't wait for us old timers to catch up. So, I've been doing this for years. I think my first exposure probably to it was when I was working at Walter Reed. They actually had a 3D printing lab there that was very advanced, and we were working with patients slash soldiers that were actually going back to active duty. So they definitely put everything through the ropes as far as being durable and functional for them. So that's kind of sort of was my first access to this, introduction to it. And then now in private sector, again, working with the helmets with the children, working with sockets for our amputee patients. I remember some of the first 3D printed ones that I saw were, not the most beautiful thing you'd ever seen. Also, not the lightest weight things,
Yeah.
because of the durability that a prosthesis needs to have, the socket needs to have. The answer was, add more material to make it more durable. So they were pretty heavy and pretty cumbersome. Patients didn't particularly care for them, but like I said, the designs we have now are pretty streamlined, pretty lightweight, and very, very durable for the patients to use.
That's pretty cool. And so you said that, the older style stuff was not, necessarily a hit with patients. How
Right.
do they tend to respond nowadays to the process of the scanning, to the 3D printed objects themselves?
So, the process of the scanning, the patients are very interested in. That it's just amazing to them as far as that goes. They think it's the coolest thing. Again, because I mean the children don't seem to be as think it's as cool. I mean, they think it's cool in the appointment, but they aren't as taken aback by it, because I think it's more so they're just used to this stuff. Whereas the
Right, they
parents will
just
be like,
expect
oh,
this.
Yeah, parents are like, "I never expected something like this," and, like, a lot of the response, especially again with the helmets that we've been getting, from the parents are just like, I don't know why, like, more people aren't doing this, why, why this isn't more widely used and readily available, because, I mean, so many of the patients that we're seeing for those helmets, again, the process is so quick and easy, and then it's so much more functional, because some patients have come to us that have had the older style design, and they're just like, "Why would you ever go back to something like this?" So definitely positive reports on it as far as that. And again, the socket designs that we're using and the bracing that we're using. I mean, one of the really great things about it too is just the turnaround time, how fast it is. Like traditionally, we would cast a patient and then we would have to fit them in a diagnostic socket. So you're waiting for that to be, modified and fabricated, and then once that diagnostic socket fits, you're then going again into possibly another diagnostic socket or a definitive socket, but you're waiting for that to be fabricated. Whereas with these, we do some scanning. Sometimes we can do a little bit of modification digitally, and then boom, we're getting the finished device right in, ready to go.
That's pretty neat.
Yeah.
And that accessibility, that really quick turnaround, makes all the difference too when people are super duper motivated to be making improvements. It's frustrating to be delayed because, well, it does take time to make things, and having less time to make things, let alone things with a really cool process that they get to see happening potentially right in front of them,
Yep.
is definitely the future of PT happening right now. So you mentioned some of the common things you guys print, the helmets. You've talked about some of the different kinds of sockets that you print. Um, what are some of the more unique or interesting things you guys have printed or made in the past couple of years?
Um, Probably again, the sockets and the helmets, again, just because of how quick it is and how positive the response have been some of the more interesting things. Socket design for our patients too, like, everybody's leg is completely different. So you do definitely do have some strange ones as far as that goes. Also there's, we have some patients that have, like, I've worked with, again, at Walter Reed in the VA. I've had some patients that may have had, been IED victims, things like that. So then you're dealing with hypertrophic ossification. So they have very strange, not the normal anatomy. I mean, it's already not the normal anatomy we're dealing with, but then, they may have like bony overgrowths. Again, the ossification that just kind of sort of changed the shape of everything. So being able to accommodate those unique shapes and forms and things like that has been really rewarding. And then again, some of the 3D printed componentry that we've utilized, like I said, for when we were at Walter Reed for the higher activity guys and women that serve our country and are actually, despite amputations, going back into active duty. Just it was amazing to work with them as far as that goes. So there were some different designs on feet, and also some different designs on bracing that we did with them as well, utilizing carbon fiber and advanced materials and things like that. That was really cool to see.
That is super cool. This actually ties in a little bit to one of the things we're discussing in one of our other pre-con sessions about AI and VR and AR. Because when I was able to shadow for a short rotation at Walter Reed as well, and I got to see the DARPA room, which
Hmm.
is the it's
Yep.
this, for those who haven't been there. It is a big room that basically creates a VR space, except it's not actually like a VR headset you put on. It's just the whole thing is surrounded by screens. There's a split belt treadmill. It's on hydraulics, so you can simulate being on a ship with like the encompassed environment around you. And they do this to test and prepare folks for readiness to return to combat environments or to service deployment environments, with prostheses potentially that have been modified or retrofitted or 3D printed, which is just incredibly cool. Not to get too far off topic, though, for the folks who are coming to these sessions, if they could leave your session with like one key piece of information, what would you want it to be?
Um, just that, again, like you said earlier, that we say that this is the future, and it is the future, but a lot of it is available right now. So, I mean, definitely, if you haven't been exposed to it yet, as far as my field goes with a prosthetist orthotist, reach out to your local prosthetist or orthotist, have a discussion with them about the availability of these types of items. You may be surprised at what is available. A lot of it is, again, with the helmets for the children, there's bracing for the children, there's bracing for adults. There's the socket designs for amputees. So it's not just bracing, it's not just prosthetics. It's the full gamut that is readily available now. And And the good thing about it is we are getting like real-time feedback. So improvements are being made with it, on a daily basis. When something comes back and we're like, hey, this is wrong, a lot of times we could fix, if we can't fix it right there in the lab, then we're talking to the manufacturers. They're doing it for us, and they're coming up with a solution super fast, and being able to provide that for our patients almost again in real time.
All right. So this is going to be yet another pre-con session that's going to have stuff that's directly and practically applicable that they can take and potentially put into practice or reach out into their network to put into practice straight away, which I think sounds pretty valuable to me, but I'm definitely not at all biased on the topic. But if this sounded like an interesting subject matter to you, you guys definitely want to show up for the MovePA pre-con sessions. Registration is available now on the MovePA website, and you'll have a chance to see some of Jason's productions and hear about his experience working as a prosthetist and orthotist with this 3D printing component. Hopefully, we'll see you guys there.